My name is Jim Kalinowski. This video is for MPH 570 for the Masters of Public Health program at New Mexico State University. It is entitled Parkinson's Disease, the disease that keeps on giving for a lifetime. A lifetime of problems and heartaches for the patient and their family. As this graphic depicts, Parkinson's disease has a multitude of problems associated with the disease and is progressive in nature, meaning that it only gets worse as time goes on. Parkinson's disease is the 14th leading cause of death in the United States, surpassed only by its close cousin, Alzheimer's disease, which is number 7. The behavioral change theory can be used to change the behaviors of those affected by Parkinson's disease and the policymakers who make decisions about the environment. Patients can be taught to use a cane to prevent falls. They can be motivated to take their medications as prescribed by their doctor, and they can be encouraged to be aware of choking risks associated by difficult swallowing. Policymakers can be educated about the risks associated with chemicals that have been linked to the increased incidence of Parkinson's disease. They can be motivated to make policy decisions that protect the environment and the people who live, work, and play in our communities. They can also provide funding in the form of grants to continue the research into the causes of the disease and the development of new treatment options. Parkinson's disease is not as well known as Alzheimer's disease because it is not in the public eye since Michael J. Fox and Muhammad Ali are not in the news anymore. There are 50 to 60,000 new cases diagnosed each year in the United States alone. Although Parkinson's disease is a fairly common neurological disorder in adults, it is estimated to affect over 2% of those aged 65 and older. The National Parkinson's Disease estimates 1 million Americans have Parkinson's disease. It is estimated that 50 to 80% of those with Parkinson's disease will eventually develop Parkinson's disease dementia. According to the Parkinson's Disease Foundation, an estimated 7 to 10 million people worldwide are living with Parkinson's disease. The incidence of Parkinson's disease increases with age, but an estimated 4% of the people with Parkinson's disease are diagnosed before the age of 50. Men are 1.5 times more likely to have Parkinson's disease than women. What is Parkinson's disease? Parkinson's disease is a member of the dementia family. Dementia is a general term for loss of memory and other mental abilities severe enough to interfere with daily life. It is caused by physical changes in the brain. There are several types of dementia that are classes under this dementia umbrella. They are Alzheimer's disease, vascular dementia, and Parkinson's, among others. All these diseases affect the brain in one form or another. The most heard of in the dementia family is Alzheimer's because it is in the news so much. Parkinson's disease was not paid attention to until Michael J. Fox developed it at age 30, and Muhammad Ali, the fighter, was diagnosed in later life for all the head blows he took in the boxing ring. The common range of age to get Parkinson's disease is late 50s into the 60s. What causes Parkinson's disease? In some people, genetic factors may play a role. In others, illness or environmental toxins or other events may contribute to Parkinson's disease. Scientists have identified aging as an important risk factor. There is a 2 to 4% risk for Parkinson's disease for people over the age of 60, compared with a 1 to 2% risk in the general population. The vast majority of Parkinson's disease cases are not directly inherited. About 15 to 25% of the people with Parkinson's disease report having a relative having the disease. In large population studies, researchers have found that people with an affected first-degree relative, a parent or a sibling, have a 4 to 9% higher chance of developing Parkinson's disease compared to the general population. Some studies have demonstrated that prolonged occupational exposure to certain chemicals is associated with an elevated risk of Parkinson's disease. These include insecticides, pesticides, fungicides, and herbicides that are commonly used in crop production, as well as general household use by gardeners. In 2009, the United States Department of Veterans Affairs added Parkinson's disease to a list of diseases possibly associated with the exposure to Agent Orange. Head injuries may increase the risk of Parkinson's disease. A recent study found that people who sustained head injuries were about 4 times more likely to develop neurological diseases later in life than those who never had such injuries. Those who had involved head trauma involving loss of consciousness, skull fracture, prolonged memory loss, or even severe complications were 11 times more likely to develop Parkinson's disease than those who had never sustained head trauma. People with mild head injury who do not lose consciousness or experience memory loss lasting at least 30 minutes face no increased risk, according to the finding published in the Journal of Neurology. In the report, the researchers present several theories about head trauma might promote Parkinson's disease. One possibility is that the blood-brain barrier becomes disrupted during head trauma, allowing damaging proteins or other substances in the blood to enter the brain. Another is that the head trauma causes to make destructive protein. The third possibility is the head trauma kills brain cells immediately, and over time, further brain cell loss from natural aging fuels the disease. What are the symptoms of Parkinson's disease? Muscle rigidity is one symptom, and it is the inability for the muscles to relax normally. Most people with the disease develop some degree of rigidity or stiffness of the limbs. Tremors, in general, begin in the hands and arms, although it can also occur in the jaw or the foot. Tremors typically involve the rubbing of the thumb against the forefinger and is more apparent when the hand is at rest or you are under stress. Bradykinesia is the slowing down of movement and the gradual loss of spontaneous activities. There can be changes in walking. This commonly includes the swing of the arms or the taking of short shuffling steps or even freezing spells, difficulty starting to walk and difficulty stopping, and difficulty maneuvering turns and corners. Is there a definitive diagnosis for Parkinson's disease? Unfortunately, there is no single test or combination of tests at this time that conclusively determines that a person has Parkinson's disease. The diagnosis of Parkinson's disease is based on physical symptoms and evaluations by a physician who specializes in neurology. The dementia related to Parkinson's disease is generally diagnosed a year or more after the initial diagnosis of the Parkinson's disease. Since individuals with Parkinson's disease are at high risk of developing dementia, doctors monitor patients with Parkinson's disease closely for signs of thinking changes as their disease progresses. When someone with Parkinson's disease develops thinking changes, doctors use magnetic resonance imaging (MRI) of the brain to rule out tumors, structural changes, and evidence of vascular disease. Here we have a comparison taken from a positron emission tomography or PET scan between a normal brain and a brain with Parkinson's disease. Fluorodopa, otherwise known as F-dopa, is a fluorinated form of L-dopa that is synthesized for use as a radio tracer in PET scans. Current studies employing the use of F-dopa for PET scans have focused on analyzing the efficiency of neurons in the brain that utilize dopamine. This test is useful in distinguishing Parkinson's disease from other types of neurodegeneration. The bright orange areas in the scan on the left show a robust uptake of fluorodopa in the brain, indicating normal dopamine functions. The image on the right shows much less uptake of the fluorodopa, indicating a significant loss of dopamine receptors in a person with Parkinson's disease. What are the treatments for Parkinson's disease? Levodopa is the most effective Parkinson's disease medication and is a natural chemical that passes into the brain and is converted to dopamine. Dopamine agonists, unlike levodopa, don't change into dopamine. Instead, they mimic dopamine effects in the brain. There are a few more drugs available, but the side effects are not pleasant to deal with, and sometimes the drugs prescribed have a worse side effect than the disease itself. On the surgery side, deep brain stimulation is the implementation of electrodes into a specific region of the brain. The electrodes are attached to a generator implanted into the chest near the collarbone that sends electrical impulses to the brain to reduce the Parkinson's disease symptoms. This procedure has its own risks associated with any surgery. Certain exercises, such as Tai Chi, have been shown to reduce the physical symptoms of Parkinson's disease, allowing patients to avoid the use of the drugs for longer periods of time. Conclusion. We have seen a recent increase in the number of Parkinson's disease diagnoses here in the local area. Many of these are in the workers who pick our crops and work in the local dairies. We also have retirees coming from the Midwest and East Coast who are over the age of 60. Parkinson's disease is a difficult disease to deal with, both for the person diagnosed with the disease and their family members. There are 15 to 25% that inherit the disease from the family member. And you do have a certain percentage of Parkinson's disease cases that are caused by head injury. But by and large, the cases of Parkinson's disease may be caused by the chemicals used to control nature's pests and make our gardens look pretty. Farm workers and their families are exposed to these chemicals on a daily basis while working in the fields. Exposure can occur by direct contact, as with Agent Orange, through overspray of the chemicals, or just plain bad luck of being downwind of an aerial spraying. Since these chemicals are linked to Parkinson's disease and pose such a health hazard, wouldn't it be wise to remove them from our environment and find some other less harmful way of controlling nature's pests? By putting a permanent ban on these chemicals, we can make our environment a safer place to live, work, and play. Policymakers control the money available for grants to study diseases such as Parkinson's disease. Money which can be used to find the direct cause or causes of the disease. Money to work toward a test or set of tests that will give a definite diagnosis. Money to educate the public about Parkinson's disease. Grants are needed to further this research into this disease. Policymakers also hold the power to ban the use of harmful chemicals in our environment. Policy changes are necessary to prevent the continual spread of the toxins that are fueling the growth of this disease. These are the sources I used to find the information that I used in this video.